Hello, I'm Jessica Turner and I work for the Rock County Public Health Department. Today is May 1st, 2020, and this is week 2 of Rock County Public Health Department's question and answer videos. In this week's video, I'm going to address some questions that we've received concerning masks and cloth face coverings. There's been a lot of confusing information out there on this topic, and some of the guidance has changed over time. So hopefully my answers to these questions will clear up some of that confusion for you. Right now, the CDC is recommending that we wear cloth face coverings in public settings where other social distancing measures are difficult to maintain. The Wisconsin Department of Health Services says that we should wear face coverings whenever we go out to conduct essential activities such as going to work, going to the grocery store, or enjoying outdoor activities, while also maintaining physical distancing. However, they also warn us that face coverings could increase the risk of spreading the novel coronavirus if you reduce other measures such as physical distancing and frequent hand washing. Already this guidance is confusing and it's seemingly contradictory. Basically, what we're saying here is that you should wear a cloth face covering anytime you leave the house to go anywhere where there will be other people. But you also have to remember that even if you're wearing a mask, you must also maintain that physical distancing. You must also wash your hands frequently, and you must cover your cough or sneeze. So let's move on to our first question. Question number 1, why should I wear a cloth face covering? The short answer is you should wear a cloth face covering to protect others in case you have the novel coronavirus and don't know it. However, you should never put any type of face covering on a child that's under the age of 2 or anyone that is otherwise unable to remove the mask or face covering on their own. If you have trouble breathing under normal conditions, you also should not be wearing a mask or a face covering. Our second question number 2, why can't I wear a medical mask instead of a cloth face mask when I go to the store? This is a very good question. You may have an open box of masks at home from a home improvement project or a cleaning project, and you might have some left. So why can't you wear these to the grocery store? Well, the answer is you can, but there are some things that you may want to keep in mind. First of all, these masks are designed for one-time use, and they're in short supply, so you won't be able to go to the store and buy more if you run out. And these types of masks are really what you're going to want to save in case you or someone in your household gets sick. And I'm going to cover this a little bit more in the next question, which is question 3. What is the difference between a face covering, a surgical mask, and an N95 respirator? All of these look different, but the biggest difference is the type of protection each one gives you. Face coverings, for example, cloth masks or our bandana here, are just anything that cover your nose and mouth. These don't protect you as much as they protect other people from your respiratory droplets. We know that we spread the virus when our infected droplets, or in other words, our saliva, get into another person's eyes, nose, or mouth. The less droplets that get into the air, the less likely we are to infect someone else. It's important to note that you can pass on the virus to other people even if you don't feel sick. In fact, you may never even know that you have the virus. That's why it's recommended that everyone wear a cloth face covering, and it works best when everyone is doing it. Next, we have a surgical mask. They look like this, and this type of mask has been tested and certified by the FDA. These are generally designed for one-time use. They fit on the nose. Here it has a little metal piece that you can use to adjust it, and you want to pull it down over your chin. Because they don't have a tight seal, it doesn't really protect the wearer much from viruses that are in the air. So again, this type of mask is designed to protect other people from your respiratory droplets. This provides more protection than a cloth face covering though. So this is what you would want to save and use if you are sick in order to keep your caregiver from also getting sick, because they're going to be in close contact with you. Finally, we have the N95 respirator that may look something like this, but there are several different kinds. This type of mask is also tested and certified. This is going to provide the highest level of protection to the wearer out of all three of these types of face coverings. In fact, the 95 and the N95 means that this mask is 95% effective. The N95 mask has a tight seal, so it protects the wearer from breathing in anything that might be in the air. Now, because it has a tight seal, the wearer should be fit tested before using it to make sure that they're wearing the correct size and model to create this tight seal. The N95 masks are routinely worn by healthcare workers and are generally designed to be worn for short periods of time and thrown away after use. These masks under normal conditions would be available to the general public, but you're not likely to find them in stores right now. In fact, because of the shortage of supplies, healthcare workers are even having to sterilize and reuse these masks several times. So now our final question. Question 4, how do I properly wear a face covering? This is really important. If you don't wear your face covering correctly, you're not doing anybody any good. So cloth face covering can mean many different things. It can be something that's sewn with a sewing machine, or it can be your simple bandana here. But no matter what type of face covering you use, there are some important points that you want to remember. Number 1, your face covering must cover your nose and mouth. Ideally, it should go from the bridge of your nose to under your chin. If you don't cover both your nose and your mouth, you are spreading your respiratory droplets into the air. Number 2, it should have a tight fit. Whether your face covering has ear loops or straps, it should be able to be fastened in such a way that it will remain tight and minimize these gaps that can occur between the mask and your face. Number 3, it should include multiple layers of fabric, but remain breathable. There have not been any conclusive studies to tell us what type of fabric or what style works best, and there are many different variables that come into play. But multiple layers will most likely give you more protection than just one layer. The best rule of thumb is that if you hold it up to sunlight and you can see through it, it probably isn't very effective. Number 4, make sure it fits comfortably so that you're not adjusting it. This is really important, and I can't stress this enough. Do not touch the front of your mask after you put it on. This goes for while you're wearing it and when you take it off. Number 5, always wear a reusable mask with the same side facing out. So if you're using something like our bandana or a scarf where it's difficult to tell one side from the other, make sure you mark it so that you're always wearing the same side out. Number 6, wash your hands before and after putting your mask on and taking it off. This is going to give you some added protection in case your hands are contaminated, or you accidentally contaminate your hands while you're putting your mask on or taking it off. You don't want to be bringing that virus straight to your face, so make sure you wash your hands before and after you put the mask on and before and after you take the mask off. Number 7, never wear a damp mask. It's a good idea to have more than one mask so that if your mask becomes damp while you're wearing it, you can switch it out for another one. And last but not least, number 8, always wash your face covering after you wear it. Take it off, put it right into the laundry. You can wash it in the washing machine with regular laundry soap. You would want to use hot water and then dry it in the dryer with hot air. That's all I have for you today. Hopefully my answers have helped clear up some of the confusion you may have had about face coverings. If you don't have a face covering and you're not sure how to get one, the CDC and the Wisconsin Department of Health Services both have multiple resources on their websites and instructions on how you can make your own. Remember that these work best when everyone is wearing them, and you must always continue to maintain that physical distance, wash your hands, and cover your cough or sneeze. When at all possible, the best way to remain safe is to stay at home. If you'd like us to answer your questions in another video like this, you can submit them to covid19.questions@co.rock.wi.us. We'll be posting another video next week, so until then, we hope you and your families are safe and healthy.